When the call goes out, these EMS and rescue workers are ready to treat any type of illness or injury.
We got a 7.5 tube check. When we got him out of the car check, he was combative.
They're an integral part of the emergency care system, and their quick action can mean the difference between life and death. Today, you're going with us. We're riding along with first responders, EMTs, and paramedics as they practice the art of street medicine. One of the first responsibilities for EMS teams is cervical spine immobilization. Ambu provides rescue workers with the latest in technology right at their fingertips. Ambu's most recent advance is the Perfit Ace adjustable collar for extrication. Whether you operate as part of a first responder team, BLS engine, or ALS unit, stabilizing the victim's spine is one of your primary responsibilities. Ambu's Perfit Ace is the industry's first truly adjustable collar. It's a rigid one-piece collar with Ambu's unique flip chin piece for easy airway access. The Ace folds completely flat, which requires less storage space, and inventory is reduced by stocking only one adjustable adult collar. By securing a better fit to the patient, it improves immobilization, and using the Perfit Ace is literally a snap. Have one rescuer manually stabilize the head and neck, gently holding the head and neck in the neutral alignment position. If resistance is felt or an increase in patient discomfort is noted, follow your established protocols for immobilization of the cervical spine in the presence of known or suspected cervical dislocation. Once the head and neck are manually stabilized, a second rescuer should apply a Perfit Ace collar to the patient. Size the collar using one of the 3 recommended techniques. Sizing or readjusting the collar on the patient should be approved by local protocol. Measure the distance between an imaginary plane drawn horizontally and immediately below the patient's chin and a second horizontal plane drawn immediately on top of the patient's shoulder. Compare this distance with the distance from the collar sizing line to the lower aspect of the plastic collar body, not the foam. The Perfit Ace is preset to the necklace size 3 position. If a larger size collar is needed, disengage the safety locks by pulling up on the safety buttons. Adjust the collar to the appropriate size according to the number of fingers used. The Perfit Ace provides 16 settings between the traditional necklace size 3 and tall size 6. Simply pull the collar apart until the distance between the sizing line and the plastic collar body equals your finger measurement. Engage the safety locks by pushing down on the safety buttons. If the Perfit Ace needs to be resized to a smaller position, disengage the safety locks and pull out on the ratchet arrows. The Perfit Ace may now be adjusted to smaller sizes. Reset the ratchet latches by pressing in on the arrows. Now engage the safety locks by pressing down on the safety buttons. The Perfit Ace collar can be pre-sized to the 4 standard adult positions: necklace size 3, short size 4, regular size 5, and tall size 6. This is accomplished by bringing the guide arrow in line in the middle of the number marked 3, 4, 5, 6 on the 4-color label. Disengage the safety buttons and pull the collar apart until the arrows line up in the middle of the desired number. Re-engage the safety locks by pressing down on the safety buttons. Because the chin piece and occipital section are always consistent, sizing on the patient is possible. Pre-assemble the collar by holding the collar near the tracheal opening with one hand. Place the index finger on the foam side of the chin piece on the center rivet and the thumb on the plastic side of the chin piece on the center rivet, and simply flip the chin piece from the back of the collar to the front of the collar. This automatically forms the chin piece and places it in the position of function. Disengage the safety locks by pulling up on the safety buttons. With one rescuer holding the head in the neutral alignment position, slide the front of the collar while in the necklace size 3 position along the patient's chest and position the chin piece by placing under the patient's chin. Pull the bottom portion of the collar down until it meets the patient's sternum. Re-engage the safety locks by pressing down on the safety buttons. The collar body should rest on top of the patient's shoulder and against the sternum without gaps. Proper application of any extrication collar requires 2 individuals. The first rescuer should maintain stabilization and neutral alignment of the head and neck by grasping the head with a spread finger technique. The second rescuer should slide the front of the collar along the patient's chest and position the chin piece. The collar body should rest on the top of the patient's shoulder and against the sternum without gaps. The patient's chin must rest securely in the chin piece in the neutral alignment position. While holding the front of the collar in place, wrap the back of the collar around the back of the patient's head and neck and secure to the front of the collar with the Velcro tab. Adjust the Velcro tab as necessary by holding the front cutout of the collar and tightening the Velcro tab. If there is a gap between the collar chin piece and the patient's chin, you may readjust the collar to fill the gap by pulling out on the safety buttons and pull the bottom portion of the collar down until it meets the patient's sternum. Make sure one rescuer is holding the patient's head in the neutral alignment position. If the patient is supine, slide the back portion of the collar directly behind the patient's neck. The collar may be applied from either side. Once the back portion of the collar is evenly positioned behind the head, the front portion of the collar can be positioned under the chin. While maintaining the proper positioning of the collar with one hand, attach the Velcro with the other hand. Ensure that the loop Velcro tab is firmly attached and parallel to the fixed hook Velcro tab on the front of the collar. Maintain neutral head and neck alignment during the entire procedure. Once the collar is properly applied and the patient is immobilized, the head should not be released. Further immobilize the head and neck with head blocks or an Ambu Perfit head immobilizer and secure the patient to the backboard with appropriate retention straps. What sets the Ambu Perfit Ace collar above other collars is its innovative design. The Ace provides a custom fit for each adult patient, which increases the team's efficiency and improves immobilization. Because you're stocking just one adult adjustable collar, the Ace decreases inventory, freeing up valuable storage space. The Perfit Ace is radiolucent, CT, and MRI compatible, and it has the same color coding and numbering system as Ambu's standard Perfit collars. It's easy to use and ideal for EMS, first responders, fire and rescue, and even law enforcement. Quite literally, using the Perfit Ace is a snap. The Perfit Ace extrication collar. Innovative design and application from Ambu, the world leader in products and training for the emergency services. At Ambu, we save lives worldwide.